Welcome to today. Hi replay viewers, nice to see you. My name is Heather Rodriguez. Today's fertility scope is going to be about blocked fallopian tubes and what we can do about it naturally, what the options are, and how we approach it differently as natural practitioners and from the natural angle. So let's jump in. Okay, so blocked fallopian tubes. So many of you are here because you are experiencing this, think you might be experiencing this. So some of this might be kind of like blocked fallopian tube 101. But I'm going to cover it real quick just to make sure that we start on the same page. So blocked fallopian tubes is one of the more common reasons that women are experiencing infertility. So what that means is that there's a blockage in the fallopian tube. The fallopian tubes, oh, I should get my little uterus out. Here, it's right here. Just one second, I'm going to grab my uterus. I'm going to grab my plastic uterus for class. Any chance I get to use this, I love it. Okay, here she is. We should probably name her. What should we name her? All right, so this is going to be our visual while I'm talking about this, because I think visuals help a lot. Okay, so here we've got, this is uterus. And this poor little uterus has every single thing going on that could possibly go on. This is, everything. So my whole point is, so this is the uterus. These are the fallopian tubes. Right? And so the fallopian tubes will connect to the ovaries. Uterina. Thanks, Tiffany. That's a great idea. This is uterina. And so these are the fallopian tubes. So this is what we're talking about. This is the uterus. Fallopian tubes connect. Ovaries are going to be right down here. This is like an ovary cut open. And so what will happen is that the ovary will ovulate, will pump out an egg, and the fallopian tubes come, and it's amazing. They like catch the egg. So it comes out here, egg goes through here. So if there's any blockages, like you can see through here, there's, well, this is more like endometriosis, but if there's any, I'm trying to find a blockage. The blockages will be found somewhere within the tube. So there's like a visual for you of uterina, of kind of what I'm talking about. So that's what blocked fallopian tubes are, is these tubes are blocked by scar tissue. And that can be caused by a couple different things. One of the main causes is going to be pelvic inflammatory disease, which is going to be caused from having a STD that went undetected, and there was an infection that happened, and that infection can cause scar tissue. It also can be caused from endometriosis, fibroids, uterine fibroids, ectopic pregnancy, tubal ligation, complications during a cesarean, and yeah, that's basically it. So there's a couple different reasons that it can happen. So what happens to get it diagnosed, there's generally a couple steps. First, you'll get a HSG. How many of you have had an HSG? Is that something that you've gone through? It's basically where they will inject dye into your uterus so that it fills up the uterus, it fills up the fallopian tubes, and then they take an x-ray so that they can see what's going on. And someone was saying it was painful. Tiffany's had one. Yeah, so you guys have all, yeah, so you know what I'm talking about. And they can take a picture and they can see if there's blockages. So that's kind of step one. If you've been trying to conceive for a while and you're not quite sure, that's actually one of the first tests that they will do as part of the fertility panel, fertility testing, just to make sure there's not blockages. So once that's actually, if that's diagnosed, then they can also do a laparoscope. I don't know if any of you have done that. Have you gone to stage 2 where you've done the laparoscope, where they'll actually go in with a little tiny microscope and they'll look around to kind of see where the blockage is and what's going on. So so you have, okay, interesting, yep. And you have not. Thanks so much for sharing, Tiffany, I appreciate it. Okay, yeah, so that's kind of the stages of it. And then there's, whatever they're going to suggest for you medically. So the thing with blocked fallopian tubes and natural health. So we're going to jump into the area where I'm able to help you or able to teach you about. So there's a couple things with it. One of the things, thanks for sharing, Lorraine, thank you so much. So one of the things about it is the way that we approach it is going to be very different than a medical approach. It always is, right? So with natural, good morning, Lorraine. With natural therapies, we're helping the body to function better. We're helping the body to help to get rid of these things, or helping the body to break down these things. So it's going to be a different approach than obviously surgery. So when I'm talking about this, it's not that we're like, oh, we're going to cure endometriosis. As natural practitioners, we don't cure anything. We don't work with diseases. What I'm going to talk about here is how to actually help your body to work through this and to help break down the scar tissue. So that's going to be kind of the direction that we're going. So step number one to think about when there's blocked fallopian tubes is, with natural health, we take a step back instead of focusing on, okay, there's a blocked fallopian tube, we take a step back and be like, okay, what's going on? One has you had your scar tissue removed 6 years ago, still can't get pregnant. What's the underlying, right? So we've got, is the infection taken care of? Because that still might be recent. So that needs to definitely be addressed. Oh, and I forgot there was a statistic that was saying that it's estimated that at least 3 out of 4 women who've had a sexually transmitted disease has blocked fallopian tubes. That's so sad. That breaks my heart. Okay, so back to natural therapies. So when you're thinking about blocked fallopian tubes, what is it? There's scar tissue, right? There's scar tissue that's blocking this tiny little tube. This is the size of this looks big on uterina. This is big. It's the size of a spaghetti. It's as thin as a piece of spaghetti, okay? So it's very delicate, very thin. So there's scar tissue. That's what's causing the blockage to occur. So how we approach it with natural health is we're going to help to support the body in breaking down scar tissue, which is something the body normally does. So we're just going to help to support that normal function. A couple ways that we do it. Our protocol is we'll start with a fertility cleanse came. I have to give, Tiffany came up with that name. So we start with fertility cleansing. That's generally where we start with almost everything that we do, because we want to help increase circulation to the uterus, to uterina. We want to help to support hormonal balance, all of that. So that's just stage 1 is fertility cleansing. And then stage 2 is going to be, we use systemic enzymes. So systemic enzymes are supplements that help to break down scar tissue. They help to break down fibrin, and fibrin is the main ingredient that scar tissue is made from. So by helping to increase systemic enzymes, which are naturally found in the body, there's a greater chance that you're helping to support the body to break down more scar tissue. The next thing that we do focus on is increasing circulation is so important, and helping to again focus on breaking down adhesions and scar tissue. So massage is a great thing for that. So abdominal massage or fertility massage. The thing when it comes to blocked fallopian tubes is that it's going to be a very specific area. And one thing you might want to look into is there's a place called Clear Passages. And Clear Passages is a facility that is, they're all physical therapists, and they actually do a specific technique called the WURN technique, W-U-R-N. You can research that. It is internal. This is the only fertility massage that I ever promote, or that I like, but it's internal, so you're not surprised by that, and it's very expensive. You go to their facility and you get treatment daily, and it's internal. Okay, the rest of these massages are external, which you can do for yourself or have a massage therapist do for you. But anyway, so they do specialize in that. There's a couple different locations. Just Google them. I'm not exactly sure. I can't remember where they're exactly located, but it's Clear Passages. And we've had some of our customers and clients work with them, and so we've heard back from them on what the experience was like. And then another thing you can do is Mercier therapy. That's going to be external. That's going to be more like a fertility massage, and those practitioners are all over the country. Mercier therapy, M-E-R-C-I-E-R. Google them. Or Mind Abdominal Massage. So that's if you want to see a practitioner. Self-fertility massage is also fantastic for this, where you can just obviously apply it for yourself. Yeah, thank you for spelling that, Mercier therapy. So check that out. Those are your options when it comes to massage. So massage is going to be beneficial because it helps to increase circulation. It helps the body to eliminate tissues, and it also helps loosen and to loosen tight or twisted tissue. So something that can happen also is that the fallopian tubes can also get twisted. So something else to worry about, right? But massage can help with that. And then the next step, what we do is we support with, along with the massage, castor oil therapy, because castor oil is very good at relaxing tissues in the body. It helps to relax fascia. It's not necessarily very specific for scar tissue, but it's softening to tissues. So that's always helpful, and it's very detoxifying. So we approach it from the body, from supporting the body with circulation, supporting the body massage. And then we use herbs. Herbs are always going to be involved. So there's 4 key actions when you're using herbs to help with something like this that you need to keep in mind. Castor oil, do you recommend to use every day? For short periods of time, yes. I wouldn't use it every day for 6 months. For regular use, I'd say about 3 times a week, 3-4 times a week. We don't suggest castor oil packs while you're on your period because it increases your blood flow. So if you have a heavy flow, it could cause flooding. If you have a light flow, it's probably fine. We just don't want to make you flood. No other way of saying that. You're welcome. Okay, so there's 4 key actions when you're using herbs to help support the body with this. So we're helping to support the body to decrease infection. We're helping to support the body in decreasing inflammation and scar tissue, right? So antibiotic type herbs. So antibiotic herbs are going to be golden seals, one of the main ones that we use. This is going to help clear up any infection that there still might be. And this is done in an herbal way. So it's different than antibiotics, but they still are very effective. We also use anti-inflammatory herbs because we want to decrease the inflammation to help to break up that tissue. Increasing circulatory herbs are also good to use because that's going to help increase circulation to the reproductive system, including the fallopian tubes. And then also hormonal balancing herbs because we want the fallopian tube to function properly, and we want everything to function properly once that blockage is removed. So it's hard to, golden seal is one of the herbs. There's many herbs. It's hard to use golden seal, Jamaican dogwood, waldiam, bladderwrack, ginger, hawthorn, a lot of circulatory focused herbs. Circulation and the systemic enzymes with that. But I do have to say with black fallopian tubes, it does make a difference where it's located. It's not, there's no guarantee. You know, it's not like, oh, do A, B, and C, and they're definitely going to become unblocked. It has worked really well for a lot of people. A good replacement for golden seal might be goldenrod. What would I do instead of golden seal? What was that other one? Berberry. It'll come to me in just one second. I just use that one because it's so specific. Possibly garlic. Yeah, garlic could be one. It comes with Fertility Cleanse, the golden tea. The golden tea. I'm not sure what that means. What else was I going to say? Oh, so it does depend on where it's located, but we have definitely seen great results with it. But there's no guarantee. You know, we're helping the body to do this, so it just kind of depends on how bad it is, how, you know, if there's multiple locations, and if the body's able to get this done. But we definitely have helped a lot of people with that. So keep that in mind. And it's something that that you should actually see results after a couple of months. It's not something that's going to take a year, you know, a year to accomplish. So no, berberine it's a compound that's found in golden seal. That's also found in some other herbs. Oregon graperoot, that's what I'm trying to remember. Oregon graperoot would be another replacement. Oregon graperoot. That's what I was thinking of, the active compound. I'm like, what's it called? So, all right, so that's it. I mean, it's pretty, you know, you think it'd be pretty complex. It's not. What it's going to take is actually consistency with these things. So, all right, guys. Well, thank you so much for joining me today. If you are new to my channel, please follow. You can just click on the little Perry Girl and click follow. And I scope Monday through Friday about fertility topics. And other times I do fun stuff. Like this week, I'm going to do one on my bath salts. I have a very amazing recipe that I make for bath salts for those of you who love baths. So I like to do stuff like that. That's fun. All right. Have a fantastic day. See you later.